Good morning. Thank you for
Hello.
joining. Go ahead.
Hello and welcome. My name is Alice, and I'll be in the background answering any Zoom technical questions. If you experience difficulties during this session, please type your question into the chat field, which is located on the Zoom panel at the bottom of your screen. We encourage you to ask questions either by raising your hand or in the chat. With that, I'd like to introduce Amara, Branch Chief of Policy, Utilization, and External Relations in the Managed Care Quality and Monitoring Division at DHCS.
Thank you, Alice. Good morning. We are excited to be here today to talk a little bit more about the local health department MOU template. We can jump in and get started. Thank you for joining us. So for today's objectives, we plan to review the released final local health department MOU template, review next steps for executing the MOU and the MOU execution timeline, and then open it up to all of you to address any questions or concerns that you may have to support the execution of the MOUs. So we wanted to just kick it off and provide a high-level overview of the goals of the memorandums of understanding. So the new 2024 Medi-Cal managed care contract requires that the managed care plans enter into MOUs with counties and third parties to ensure the whole system person-centered care approach. So this is really to align with many of the goals outlined in CalAIM, where many of our Medi-Cal members are accessing different delivery systems. So these MOUs are really intended to ensure that these members have access to the services that they need to really support their member-specific needs. So the goals of the MOUs really establish minimum requirements related to some of the key contract provisions that you've seen reflected in the local health department MOUs, such as training and data sharing. It also really helps to clarify some of the roles and responsibilities for coordination of delivery of care and services, such as services that may be carved out of the MCP's service portfolio. It also establishes formal processes for how the parties will collaborate and coordinate on population health programs, which include linking the members to community supports. In addition, it establishes data sharing pathways between the managed care plans and the other parties to support that care coordination and enable robust monitoring. It also provides overall oversight and accountability to the managed care plans. And it provides transparency on what roles and responsibilities each party may have. We wanted to just provide kind of a high-level overview of how we structure the Memorandum of Understanding, the policy guidance that we released to support this effort. So we wanted to highlight that the local health department MOU template is a part of a larger set of documents that we released. So we also released in tandem an all-plan letter that really outlines the MOU requirements. And that APL is 23-029, and it explains some of the intent and purpose behind some of the provisions. It also sets expectations on the MCP, such as annual review of the MOU. It details out requirements related to the execution and submission of the MOU for the managed care plans, and it lays out how DHCS plans to monitor the MOUs. Next, we have the base MOU template, and this contains all of the provisions that are included in each of the bespoke MOU templates, which we'll get into a little bit more detail. It clarifies the roles and responsibilities of the MCP and the other parties, and it establishes rules of engagement to cooperate and address disputes. And then it also includes some additional optional provisions that the parties may execute. We do want to notate that the base MOU provisions are already included in the bespoke MOU template, so there's no need to execute both the base MOU and the bespoke MOU templates. For today's discussion, the bespoke MOU template is referred to as the local health department MOU, which contains MCP and other parties' specific requirements. So it contains the general, which we refer to as the base MOU template, and those very specific program required provisions, including incorporating other parties' requirements based on existing guidance that have been issued. It also contains DHCS recommended optional provisions, and those are notated throughout the MOU in italics. So the parties are not required to integrate those optional provisions in their MOU, those are considered to be optional. It also links to specific policies incorporated in the MOU. Next, we wanted to provide a quick overview of the MOU resources that are available to all of you. So as a part of this effort, DHCS has also released a DHCS MOU website. And on this website, it houses the all plan letter, the base MOU template, and then each of the bespoke MOU templates. So for today's discussion, you'll be able to find the local health department MOU that is finalized and published on the website. We also anticipate releasing an FAQ to address a number of the questions that we've received throughout the stakeholder process, either through stakeholder feedback or through the webinars that we've been hosting related to all of the MOUs. And then as you may already be aware, other updates will also become available on the web. We were able to post this webinar, and we have posted the historical webinars that we have hosted. We also are committed to ensuring that these MOUs are executed, so we will be continuing to provide technical assistance as needed. So please do not hesitate to reach out if you have questions. You can reach out using the email address mcpmous@dhcs.ca.gov. This email address is also linked on our website. So if you have questions, please don't hesitate to reach out. We are happy to assist. And if we haven't done so already, if we can just drop the link to this so if, oh, my apologies. I do have a little bit of a delay. So I have jumped forward multiple slides. So bear with me for just a second. So we wanted to just provide an update on the purpose of the local health department MOU, which really contains many of the items that I've already covered previously in this presentation. But really, the MOU template seeks to improve care coordination between the managed care plans and the local health departments for programs including, California Children's Services. And really, we intend to do that by really opening up channels of communications between the two parties to ensure that care is coordinated for individuals that may be receiving services by either the MCP and or the local health department. So we really want to make sure that there is coordination occurring at the local level between these two parties. Also, the intent is to really enhance each other's parties' understanding of each other's respective services, eligibility criteria, and referral processes. I did want to notate, I know we've received some questions related to the exhibit related to California Children's Services. For managed care plans and county that operate whole child model, the CCS Exhibit F is not required. We do have a separate MOU that is required. So I did just want to make that note for parties that may be participating, or for managed care plans that may be serving whole child model counties specifically. I did just want to kind of provide a quick update on the feedback that we received. So we received 243 stakeholder comments during the stakeholder comment period. We've reviewed those comments and made changes to the MOU, which we will review in future slides. And we really just want to thank everybody's commitment and engagement as we've been working to revise these MOUs. We do acknowledge that a lot of work has gone into this. We're really excited about the engagement and coordination across the parties, and we acknowledge that there will be opportunities to refine and improve this as we learn more in the future. So we want to thank you all for your valuable feedback. We also want to notate and thank our partners who have consistently engaged and provided valuable feedback. And that includes our partners at CDPH and a number of different areas and branches at CDPH. So we want to thank you all. And then we've also consistently engaged with SHIAC. So thank you so much for your engagement and participation. All right, so what has changed since we've received that valuable feedback from all of you? So we have included a new section related to definitions, which really sets forth defined terms related to the liaison roles. We did receive some comments related to this, so we wanted to make sure that the liaison roles were very clear to both parties. Some of the other provisions, the services covered, that didn't change. The party's obligation, we didn't make any changes there. The training and education section, we did add some modifications here to allow a little bit of a ramp up period, as we understand the timing and execution of these MOUs may be very quickly. So we wanted to give our managed care plans the opportunity to train their staff on the responsibilities that will be outlined in the MOU. We also included a new provision that the MCPs must provide county members and network providers with training and/or education materials on how MCPs covered services and any carve-out services may be accessed, including during non-business hours. So that is an addition that we changed to this section. We also, another major change that we made, the referral section. So the closed loop referral policy guidance is still in flight at the department, and the MOU really codifies existing policy. So we have made these optional provisions, as this is policy that we anticipate releasing in the near future. So we wanted to include it, but these are optional provisions right now until that policy is finalized. We also have the care coordination section, which we didn't make any changes to. And then we made some modifications to the quarterly meetings, allowing them to be conducted virtually to really align with the new work environment that many of us are working in. And then also allowing the MCPs to post when the meetings occurred on their website. We really want to make sure that these are limited and not open to the public. I know we received some confusion on that, but really giving the MCP and the local health department the opportunity to collaborate on and improve their processes. And in some cases, there may be, confidential conversations that are occurring related to specific members. So those meetings will not be open to the public, which is why we've allowed those to be posted online after the meetings have occurred. All right, we added in some modifications to the quality improvement section that the MCP must document quality activities in policies and procedures. Data sharing and confidentiality section, this is an area we received quite a bit of feedback on, and so we've made some modifications that the minimum necessary information and data elements to be shared between the parties are set forth in Exhibit C of the MOU. The parties must annually review and, if appropriate, update Exhibit C of the MOU to facilitate sharing of information and data. We've also made some modifications to the dispute resolution section that disputes may be as appropriately forwarded to our partners at CDPH. The MCPs must and the LHD should document the agreed upon dispute resolution procedures in the policies and procedures. Another pretty major change, the disaster emergency preparedness has been moved to an optional provision. So the parties have the option to include this in their MOUs, but are not required. And then a new section we created was related to equal treatment that provides that nothing in the MOU is really intended to benefit or prioritize Medi-Cal managed care members over persons who are not members also receiving services from the other party. Right, and then the referral section. We also made modifications here that LHD should refer members to MCP for covered services. And then we've made some modifications to the care coordination and collaboration section that notate that the MCPs must coordinate with the network providers to determine whether eligible members have received blood lead screening and or any medically necessary follow-up blood lead testing. And that if members have not received blood lead screenings or indicate follow-up testing, MCPs must arrange for and ensure each eligible member receives the screening and any indicated follow-up testing. There's also a new provision in the population needs assessment that the MCP will meet the P&A requirements by demonstrating meaningful participation in the LHD's community health assessment and community health improvement plan process in the service areas where the MCP operates. We also made some changes to the other exhibits in the local health department MOU. So as you all are probably aware, we have the tuberculosis screening, diagnosis, treatment, and care coordination section, which really sets forward the requirements between the MCP and LHD to coordinate care and ensure members have access to TB screenings, testing, and treatments, and then outlines the MCP's responsibilities. We did have the opportunity to work very closely with our partners in the CDPH TB control branch to update this exhibit, as we did receive a fair amount of feedback on this exhibit, and we appreciate all of your input on this and our partnership with CDPH to refine this exhibit. Then we have the non-contracted LHD services exhibit, which really imposes requirements on an MCP and the LHD to coordinate to ensure members receive immunization, sexually transmitted infectious services, family planning services, and HIV testing and counseling services as required by the MCP contract. Right. We also have the maternal, child, and adolescent health exhibit, which sets forward the MCP and LHD requirements to meet the MCAG programs, and the requirements really focus on improving care coordination between the MCP and the LHD to improve access to services, including quality care for children, other population health requirements for children, and wellness and prevention programs. We revised this exhibit based on stakeholder feedback and collaboration with our partners at CDPH and SHIAC to ensure that this exhibit accurately reflects the LHD obligations for coordinating with the managed care plan. Then we have the California Children's Services exhibit, which really sets forth the requirements for an MCP and the LHD to coordinate care and case management for members enrolled in classic CCS models. As notated, this does not apply to the whole child model counties. And so I did see a question come through in the chat. We will review that question at the end and provide us some additional clarification. And then this exhibit incorporates some revisions based on stakeholder feedback and collaboration with CDPH and SHIAC, and also incorporates some policies and procedures that align with some of the new issued guidance related to the inter-county policy numbered letter that has recently been released, and the forthcoming solid organ transplant numbered letter that will be released in the near future. Right, MOU execution next steps. So the MCP should be reaching out and forming relationships with the local health departments. The MCPs and LHDs should commence discussions regarding executing the MOUs. We do just want to notate, we understand the timelines are aggressive and each of the parties needs to work through their certain processes to execute the MOUs. And this, we understand this MOU in particular is very large and contains a number of different exhibits. And so we have allowed the MCPs to show a good faith effort to execute the MOUs by January 1st, 2024. For those that are not executed by that time frame, we are allowing the managed care plans to submit quarterly reports to the department demonstrating the good faith effort. We did just want to flag LHDs are not required to sign or submit the quarterly reports to DHCS. And then we wanted to just provide an update on the quarterly reporting and when that will be due to the department. So we do have one coming up. The first quarterly report from the managed care plans will be due to the department on December 29th, the last business day of December, and then quarterly thereafter. And we wanted to just highlight this to really showcase the department's commitment to ensuring that there is thoughtful engagement regarding the execution of these MOUs. All right, we did want to kick it off with some questions that will kind of help and begin the conversation for open discussions. So do the MCPs and LHDs need any technical assistance from DHCS to support the execution of the MOUs? If so, how can DHCS support? What guidance and communication can CDPH provide that may be helpful to receive? And then are there best practices that MCPs and LHDs can share when negotiating the MOUs? So before we kick it off to this, I did just want to pass it off quickly to Michelle Gibbons to provide a quick update from her perspective, and then we'll kick it off to open discussion. While we do that, Manat, if we can pull down the slides, that would be helpful because I'd like to see everyone's faces while we have this discussion. So I will pass it off to Michelle.
Yeah, thank you. I appreciate the department's partnership in really taking a look at some of the comments that SHIAC made. I think what folks will notice is that a lot of the feedback that you all gave SHIAC has been incorporated to the MOUs. So that's really good to see. I think in terms of resources and ongoing technical assistance and support that locals are going to need, that's something that, you know, they continue to raise. I think it'll be challenging. This is a new space where, although there were MOUs that predated these revisions, those were kind of this like virtual dusty thing that sat on a shelf, and there wasn't a lot of like appetite to go in and check and make sure that both parties were doing kind of their part in that. We hope, you know, that the department will really hold managed care plans accountable to the things that they're required to do in the MOU, and that you all will make sure that that partnership is definitely continuing to happen. I think what would also be helpful is, to the extent that local health departments are experiencing challenges with partnering with their MOU, to be able to elevate that to DHCS for some assistance as well. But other than that, I just want to appreciate, you know, the department hosting the webinar. The one piece I would call out, and I called it out in the chat just as a point of clarification, the dispute resolution process has been updated, but the way that it's updated, and DHCS can correct me if I'm misunderstanding this, but the way that it has been updated is that disputes just go to DHCS. And then if DHCS needs technical assistance from CDPH to resolve that dispute, then they will go over to CDPH and partner and do the resolution that way. That is something that CHIAC advocated for, just to be fully transparent with you all, because we wanted to make sure that the disputes went to an entity that had oversight over the plans and could actually assist in resolving the dispute if needed. So just wanted to clarify that piece, but then I'll turn it back over to the department, and thank you for having us join.
Thank you so much for that clarification. And yes, the way that Michelle described the dispute resolution process is reflected in the local health department MOU. So we apologize for that confusion on that piece. And thank you for that clarification, and thank you for your partnership. All right, I will start with some of the questions that we've received in chat, and then we can take questions via hands and or chat because we really do want this to be a fruitful discussion. So I see Francesca, when will the MOU for whole child model counties not associated with Kaiser MCP be released? I want to notate that this MOU is published online already. We just are not requiring the non-impacted Kaiser MCPs and counties to execute the MOU yet, as we may be making updates to that MOU ahead of the 2025 whole child model expansion. And so we aren't requiring an update quite yet, as we want to make sure that the MOU that is being executed is reflective of the most updated version of the MOU. So there may be changes. So we aren't requiring that, but it is available on the web. If Alyssa, you can drop the link to the newest MOU template, it would probably be helpful for Francesca to reference, as it is published on the web. All right, I see the question from Deanne, describe meaningful participation. So, you know, we really anticipate that there's going to be a level of collaboration and coordination across the parties, and meaningful participation would be attending the meeting, addressing questions or concerns, and really, you know, having a fruitful engagement. We understand that that is up for a little bit of interpretation, but really being engaged and collaborating with one another to really put the member first, and ensure that where there's opportunities to improve collaboration, coordination for specific members, to do so. And so we understand, you know, there may be opportunities as everybody kind of learns their roles and collaborate on this. And so we do anticipate that there will be a learning opportunity as people begin engagement. And so, you know, if there are concerns with meaningful participation, once those partnerships have begun, please don't hesitate to reach out to the department. And Stephanie, thank you for your comment. We truly appreciate your partnership, DHCS and CDPH's partnership. It takes a village to execute a policy like this, so we truly appreciate it. And I think we've already answered the whole child model MOU question. So if there's additional clarification, happy to take it. Is it possible to get coordination of services provided by regional centers, part of this Medi-Cal MCP system of care, so that data and supports can be stronger for people with developmental and intellectual disabilities? I do want to notate we have a separate regional center specific MOU that is published on that website referenced below. And the intent is really to support care coordination between the regional centers and the managed care plans. So I would encourage you to take a peek at that MOU, as we really anticipate that is going to fulfill the need that you're identifying. Carolyn, will the MCP quarterly reports be made public? At this time, we don't anticipate making them public. We really have created this as kind of a stopgap to understand where we can provide technical assistance to the managed care plans and other parties, as we understand the timelines of these were pretty aggressive. So at this point, we don't anticipate making that information public. I think we need to give the parties a little bit of time to work through the appropriate processes before we really determine next steps in regards to what information will or won't be made publicly available. When edits are needed to be made to the MOU, how is that handled? That is a great question. So what will happen is really we anticipate and encourage the parties to collaborate and coordinate and submit a redlined version of the MOU to the department. Now, I do want to provide some clarification because I know there's been some questions and concerns related to this. So if, for example, you remove the optional provisions that are in italics, that wouldn't be considered a red line version of an MOU, right? We don't need to review those. We have specifically added those as we think that they may be helpful for the parties to negotiate in. However, that wouldn't be considered a red line version. We also understand that there are multiple parties that are looking at combining what we're referring to as bespoke MOU template. So there may be an opportunity, for example, to combine the local health department MOU with, say, the IHSS MOU, depending on the county structure. If the MOUs are combined and all of the provisions that are required are contained, DHCS doesn't need to review and approve those edits. And so we will eventually receive the final version of the MOU. But we do understand that there has been some points of clarification related to kind of the review and approval cycle of the MOUs. But really, we want there to be collaboration between the two parties. As we understand, there may be, there's going to need to be that collaboration and negotiation to really meet that local level needs. I see a comment in here about will the slides be posted or emailed out? I think they will be posted. And they are attached to the invite if you haven't already received them. And I think Sophie has also attached them above. So please let us know if you do not receive the slides. Fatima, can you please clarify the closed loop referral piece again? It is optional at this time, but will be required once the guidance is finalized. That is the intent. We are working in partnership with the other team that will be leading the development of that policy, or is leading that development of the policy, and we're working on the timing and communication of how that will impact the MOU. So right now it is considered an optional provisions. The parties do not need to include that in there, but we did include it in anticipation that the policy will be finalized and there is guidance forthcoming. All right, if we are not able to execute that by 1/1/2024, what do the MCPs need to do to show good faith effort? Will initial discussions be enough to suffice, or does a draft MOU need to be shared? So Catherine, I would encourage you to review the MCP MOU reporting template, and really we're going to be looking for the managed care plans to provide comprehensive information in that MOU reporting template for us to review. Again, we do understand that the timeline has been pretty tight and aggressive. We did create this initial reporting period, to really meet operational readiness requirements, and also for us to get an understanding of what communication has or has not occurred leading up to this point. So please, I would encourage you to fill out all the information in the quarterly reporting template, and really showcase that you've demonstrated a good faith effort, whether that's finding the person to contact and what's been discussed, and just some initial strategy and collaboration. We do acknowledge that the timelines have been pretty tight, and we anticipate seeing either executed MOUs later in the beginning of Q1, and or more proof showing that the MCPs have demonstrated a good faith effort on the next quarterly report. All right, and I see a question on the data sharing. So really the intent of that is for the parties to share minimum necessary information to ensure that coordination and collaboration across the teams. Ultimately we understand that data is the foundation of much of what we do and how we provide care to our members. And so we're really encouraging that the parties, follow existing state and federal laws and exchange the minimum necessary information to support the care coordination across the teams. All right. Lots of great questions and fruitful conversation. Fong, I see your hand raised. I will take that and then move back to the chat. Do you want to come off mute?
Yes. Can you hear me okay? Yep.
Yes.
Thank you. So we are one of soon to be 24 counties under partnership Medi-Cal managed care plan. And they said that, it's a struggle for them to kind of align across all 24 LHD, let alone all these other county and MOUs related entities. But my understanding is that this conversation between MCP and LHD or MCP and IHHS provider is really county specific. So there doesn't need to be sort of standardized reconciled language across all 24 counties. Is that correct?
Thank you. So we have been working in close partnership with partnership, ironically, as we do understand they are going to have a large footprint in 2024. So they might, have some unique processes that they're following. And I'm not sure if we have any representatives from partnership on the line, but we do anticipate that we may be reviewing their red line versions of the MOU, and then really they'll be engaging in local level conversations with you, understanding that there are going to be local level nuances. And so I think there's going to be this level of technical assistance that we're going to need to work in partnership, all of us, to understand and really meet that local level need. So I would say, additional information to really come on that. And we really still do encourage that local level participation, and we are working in partnership on this as this has been kind of brought to our attention, and we understand that they do have a large footprint, and so we really need to kind of balance the administrative effort with that local level of engagement, and we are working in close partnership with them. Do we have anyone from partnership on the line that wants to speak to it more, or?
And I'll be happy to follow up in an email between you if you're okay with that, and partnership. I just want to make sure, like you said, that the local engagement specific for my two counties, Yuba County and Sutter County, is addressed, because it's really hard to standardize, as you can appreciate, across all 24 counties.
I'm not with partnership, but I have talked to them a little bit. Can I just understand, is it that you haven't heard from them yet? Is that what I was hearing? I'm sorry to make you repeat yourself.
No, we have heard from them, but they are struggling, as I can appreciate that they would like to see kind of standardized language for MCP to LHD MOUs across their 24 counties. And I think that if you see one LSJ, you just see one LSJ. So we want to make sure that the local nuance for my two counties, Yuba County, Sutter County, are addressed and not a way to standardize across all the remaining 22 counties.
Yeah, I think that makes sense, and I can pass that along. And I think I appreciate you bringing that up on this call, because I think that's a problem, not just for partnership, but for a few of our plans, right? Because we are working from a DHCS document, right? So trying to find ways to make this work while continuing to meet the requirements that DHCS is putting on all of us. And so I know Amara's heard all about it, but that whole red line process and what's the best way to address these local nuances. So I appreciate you bringing that up, because I know that that's something that they're very focused on and that they care quite a bit about, as do some of the other plans. But all of that to say, I will let them know that this was brought up so that they can reach out. And I know that they'll just keep working with Amar and the team on how can we get these red lines approved and reviewed and pushed through in a time that makes sense and feels collaborative. So thank you.
Yeah,
I want to
do
chime in
work
really quick.
closely. I do work closely with actually them too. So I've been in correspondence with all the partnership leadership in regards to this. Catherine Barisi and her team have been wonderful.
Well, thank you for saying that. They are great, right? Thank you.
Sorry, and I heard somebody say they wanted to chime in.
That was me. My name's Hannah O'Leary. I am from Partnership. Unfortunately, I don't know that we have the exact right players here today working on these MOUs, but yeah, Catherine Baresi would be a great person to connect with on any MOU concerns from Partnership's end.
Yes, thank you. And again, I think we've been in collaboration with them, and I think that to Kate's point, right, there's this we need to find out the balance and figure out and understand that there are nuances, you know, between the managed care plans and also the local level and what that looks like. And the intent of releasing these templates is to really, you know, provide a little bit of standardization, but give that flexibility at the local level. And so Bong, have you submitted proposed redline versions that might meet the local level needs? And if not, I would encourage when you do send that email to me to include that when you send the email to our inbox and also with Partnership CC'd.
Yeah, we're not ready yet because we're gonna approach it as a consolidated MOU across all the various bespoke templates. And in addition, based on what you just presented earlier, we're not planning on revising anything that is not in italics, right? So we're only editing within the italicized section. But as you probably can expect, it's a heavy lift to consolidate across multiple MOUs.
Yes, we do understand. So I think we just need to recognize and understand, you know, there's going to be nuances, and we are committed to working in partnership with both parties to ensure that the MOUs are executed and also ensure we're meeting the goals of the MOUs, right? And so we just need to keep that at the forefront of our conversations and discussions. And you know, part of that is also allowing that good faith effort to understand that some of these need to work through the, you know, appropriate processes and ensure that we aren't just checking a box, that we are, you know, providing that coordination and collaboration and really meeting the needs of the member and putting the member first. So thank you for the fruitful conversation. We really appreciate it. So Krista Peterson, what is the expectation of how classic CCS may be accessed during non-business hours as referenced in the MOU or within the slide deck? Can you provide clarification? Are you with a managed care plan or are you with a local health department? If you have any additional clarification to provide, I think that would be helpful. If you're referring to coordination and collaboration between like the local health department contacting the MOU, contacting the managed care plan. We have, you know, this is a requirement that was already placed on the MCPs. This isn't a new requirement. We just provided some additional clarification in the MOU. So I'm not sure if that addresses your question or if you have additional questions. And then Tori, I see you have another question about the whole child model MOU. Alyssa did provide the link. Thank you to the revised MOU template. So feel free to take a look at that. And if that's, you know, there's no concerns if the counties do want to use the new MOU template for those that are providing whole child model services. We just want to highlight that we don't currently have an expectation for the current whole child model counties and plans to execute that updated MOU. All right, Monica, just a note that 10 counties that are transitioning to COES 1/1/2024 will begin as classic and then transition to whole child model. We do acknowledge that and understand that piece. I think that's a nuance that we need to kind of work through a little bit internally. We do still expect, because there is that year transition period, that MOU to be executed, but I would say send an email to us and we can kind of work through what that process looks like, understanding that we do basically have this 1 year period before we do this major transition for whole child model. So thank you for that flag. Jana, thank you for the flag on the transportation portion of this section. I think we're going to need to take that one back offline because it is a little bit more detailed. Unless we have somebody from either Manat and our partners at Integrated Systems of Care that has any additional information. Otherwise, I think we're going to need to take that one back and then provide a written clarification on the transportation section of the CCS exhibit. And if you want to come off mute and provide maybe clarification on the responsibilities where you're not seeing alignment, I think that could be helpful.
Sure. Hello, everyone. I'm just looking at the all plan letter 22008 from 2022, where, where it does state that the managed care plan is really taking more responsibility for transportation than the language in the MOU. So I'm looking at it here. I can't really find exactly the red line, but I could, drop it into the chat as well. It just does not seem to align with this all plan letter, as well as it didn't reference the all plan letter. And the numbered letter for transportation, I think, goes back to 2010, and the all plan letter was, yeah.
I am taking a look at the language, and that APL is referenced. So I'm wondering if by chance you're maybe looking at a older version. But we're happy to take it back and connect offline if there are concerns and see where we can provide clarification. It does look like the APL is referenced in 2 different sections here. And really outlining the managed care plan's responsibilities. And also the responsibilities related to the CCS eligible conditions. So yeah, we're happy to take that one back offline and look at that one a little bit more in detail.
Okay, I'll take another look as well. Thank you.
Not a problem. And I did drop the link to the newest version of the MOU in case it's just a version control issue. Can you speak to the ability to have one MOU with all the health plans in the county? If the county chooses that option, will one health plan lead for the other health plans? Is there guidance provided to the health plans on that? That is currently, we are leaving that at the local level coordination, right? Understanding that there can be multiple MCPs operating in different counties or in the same county, my apologies. And we've basically developed the MOUs to be flexible, right? To allow there to be flexibility in combining and having multiple parties sign the MOU. And so really we would look for those conversations and roles and responsibilities to be worked out really at the local level. We do want to make sure that if there are MOUs that are combined, that local level coordination engagement is not lost. And also keeping in mind that the quarterly meetings, if there is discussion about specific members, there needs to be the ability to ensure that members' information isn't shared across managed care plans. So there needs to be a forum to allow there to be opportunities to really improve, to provide that, quality improvement activity and to discuss difficult member cases between that local health department and the specific MOU to make sure that we're following compliance with HIPAA. So that can be, an option, but we need to make sure that ultimately the local level needs are still met and that we're following, state and federal laws and ensure that we're not sharing member information inappropriately. Is the LHD MOU, I think it's if the LHD MOU is not executed prior to 1/1/2024, is the effective date listed on the MOU the date of the MOU is signed, or does the effective date remain 1/1/2024? I think this might be at the top of the MOU. if that's what you're referencing.
Hi, this is Vernell from HealthNet. This is something that came up in a joint discussion yesterday, and I was just seeking clarity on it. So, where you have the MOUs posted on the website, it kind of reads MOUs effective January 1, 2024, right? But then in the actual template, there's a space where you can include the effective date. So the discussion yesterday was, what is that date? And I think the consensus was generally that it's the date that it's signed, but I said, well, there's a call tomorrow. I'll get confirmation on whether that is true or whether it needs to be January 1, 2024.
Perfect. Thank you for coming off mute. No, it would be the date that the MOU is executed. So
Okay.
Thank you for that clarification.
Yeah, I thought so, but there was a little confusion around that, because it's how it's posted on the website. So no, thank you for that. I appreciate it.
Perfect. Thank you. And then I'm seeing Janet's note about the transportation. We'll take a peek at that section and make sure there's alignment. And if not, we will discuss internally and figure out next steps. So thank you for that. We will take that offline. We appreciate that feedback. One last question from Catherine. The quarterly reporting option, if MOUs cannot execute by 1/1/2021, is for all MOUs, not just LHDs. Yes, that is correct. For all MOUs that are required as of 1/1/2024. I do want to flag there are a couple MOUs that we are requiring as of 7/1/2024, and we haven't released any information related to the quarterly reports for those yet, as we are hopeful to release and finalize them well in advance of that 7/1/2024 date, which those currently include the targeted case management MOU and then the DMC state plan MOU. All right, when the MOU has bracketed language like the parties may agree to a 3-year term, if the parties mutually agree on a different term, does DHCS consider a change that needs to be submitted to DHCS for approval? No. For example, if it agreed to a shorter term, no, we wouldn't need to approve that. These specific Q&As, many of them will be addressed in the FQ that we plan on releasing hopefully by the end of this month. We do anticipate it's going to be an iterative process. So if there are some questions that came up in this conversation, they may not be in the first iteration that you see, but maybe in future iterations. But please, if you have questions, don't hesitate to reach out to the inbox. But we do think that the MOU FAQ at this point, I think, is 16 pages. So it is going to be a wealth of knowledge and information to assist in your question, in addressing a number of your questions. All right, CHDP does not sunset until 6/30/2024, but is not mentioned in the MOU. Should this be added to the MOU for 6 months, or are we just ignoring the MOU for your program? So I would say, address that kind of at your local level if it needs to be incorporated and you're moving forward with execution long before that 6/30/2024 date, which we are hopeful that's the case, and you think it needs to be included, please include it. What's the relationship between this MOU and the contracts with the health plans for CalAIM, ECM, and community supports? So we do understand that the health plans would have contracts, for enhanced care management and community supports. And within those contracts, there are, different requirements. And so really, we anticipate, and I might ask Manat for some support on this question as well, but the relationship is really between care coordination for services that may not be included in those contracts, because they would be the ECM and community supports that have contracts with the managed care plans would be network contractors, right? So they have a few different requirements than just than providers that would just be providing services by the local health department that may not have contracts with the managed care plan. Marissa, I might ask they are separate, very distinct and separate. And so you would not use the MOU to get a contract to become an ECM provider under a health plan. It would be completely separate. Sorry, Marissa, you might be able to explain that better.
No, you said it right. So essentially, if you are going to contract with a plan to become an ECM provider, any requirements related to that would be governed by that ECM provider contract that you execute with the plan separate from the MOU. And there's a clause in the MOUs that provide that any community supports or ECM contracts that you may have with the plan are governed under that separate contract, not within the MOU itself.
Thank you. Some really great questions. We totally appreciate all of the thoughtful questions today and engagement and support as we've finalized the MOU, and we look forward to continued support and engagement as we move forward with executing the parties executing the MOUs. I do see a question from Anna. It was mentioned that there is no expectation for whole child model to execute the MOU. Will DHCS be providing whole child model counties from information on when it will be executed? So it's slightly confusing, and so I would say for counties that are not impacted, and I'm not sure if we have whole child model counties on the call today, but for counties that are not impacted by the 2024 transition, so where Kaiser will be operating as a prime plan, we do not currently have a requirement to execute a new whole child model MOU. Because we do anticipate changes to the whole child model MOU ahead of the 2025 whole child model expansion. And for the managed care plans, the only requirement is for Kaiser to execute the whole child model MOU. I'm hoping that provides clarification. I know it's a little convoluted, but the parties that are required to execute the MOU, we have communicated that in writing. And if you haven't received communication from us, then you aren't required to update and execute the new whole child model MOU. Yeah, it's absolutely optional. Go ahead, Michelle.
Yeah, I just want to put a finer point on it so that we're not confusing the discussion here. So this discussion today that we're having is just around the LHD MOU. And while CCS is a component of that, it's just one component of the LHD MOU. And every plan is supposed to be working with the health department, every health department, to execute this LHD MOU, irrespective of what your model of CCS is. So this LHD MOU is required for everyone. And then there is a separate MOU, there's multiple actually, and CHIAC has some resources as well to help local health departments keep this all in the right buckets. But there is a separate effort on MOUs happening with CCS. And then depending on your model type and transition type, there are certain ones that locals are responsible to enter into. But I just want to make sure that folks aren't confusing that, like, hey, if I'm not a Kaiser transition or I'm not newly into whole child model, I don't have to do the LHD MOU. That LHD MOU is separate and distinct and something that every plan and every local health department should be discussing and entering into.
Thank you, Michelle. Does anyone have any more questions? Tanisha.
Hi, Amara. This is Tanisha with Santa Barbara County CCS Whole Child Model. This has come up on a few other calls, and I think where that confusion is, it's Exhibit F, right? So if you're a whole child model county, Exhibit F does not have to be executed for the LHD MOU. So that's that confusion that whole child model counties keep going back to. So I just want to clarify that for whole child model counties, we do not have to execute Exhibit F because we are a whole child model CCS program. Thank you.
Yes, thank you. And I do want to notate that is contained in the local health department MOU as well in Exhibit F. There is language in there to clarify that point. And then we also are going to be, this is definitely a point that we will be including in our FAQ. And then I would encourage, to Michelle's point, it sounds like CHIAC also has resources to provide clarification, as there are a number of MOUs related to the CCS program. We have a couple of minutes left. So happy to take any other questions. If we don't have any questions, I truly want to thank everybody's engagement and commitment to these MOUs and really putting the member at the forefront of your discussions. We really look forward to hearing how the execution of the MOUs are going and hear updates and receive updates from our managed care plans in the near future. And know, please, that DHCS is committed to supporting this effort. So we really want to thank you all. And we know this has been a significant lift, and we really appreciate our partnership with SHIAC and CDPH. And I know a number of our colleagues from CDPH are on the call today, so thank you for joining us and supporting this effort as well. And with that, I think we'll wrap up and wish everybody a very happy holiday. And thank you so much for joining us.